most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Not only our opinion, but only our opinion. I was
Yeah,
just going to say
that's the way it is.
Don't agree. 5 best tennis elbow treatments to stop pain. That's what we're going to talk about today.
Yep.
And if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, join us on our social media channels and our website, bobandbrad.com, because we're always giving something away. Go to the giveaway section. This week we are giving away the RENPHO white noise machine. Really great little device to help give you sounds to help you sleep.
Oh
yeah, you got
there
it right
it
there.
is.
Yep, really got a good speaker on that thing. You can go to Facebook also and find it on there. And if you want a shorter version of us, and for those that complain that we ramble on, go to Instagram and Twitter. We have a 60-second version of our show.
I still have a hard time believing that we ramble. Bob. Why, Bob?
Why, Bob? All right, Brad, you're going to take the control of the reins here.
By the hand, by the shoulders.
Yeah.
We're going to talk about the tennis elbow. First, we should talk a little bit about the anatomy, where the tissues are that are irritated, causing the pain.
Because this will help you treat it by understanding the anatomy.
Right. And I'm wearing some things on my elbows too. We're going to explain those in a little bit. But if you look at Sam, the muscle groups that are on the back side of the elbow to the wrist, and they make your wrist extend. Okay. So if you look, I've got a piece of kinesio tape that flexes with it. So it hopefully gives you some idea. The black lines represent the fibers of the muscles, and that's important for 2 of the treatments that we're going to do with it. But right up here is where you get that tennis elbow, and it's where these muscles that connect to the wrist connect to the bone
attached
here.
At that point.
And that's the point where you get these micro tears and it becomes very painful. And a lot of times you just touch that or tap it like that. It's very, very painful. It's just irritating, something you want to get rid of.
I thought you were going to do you say bad things when that happens.
Well, Bob, I'm trying to get away from that. But yeah, I have said bad things. So, and there's just a number of things that can stress those muscles, from bending your elbow to extending the wrist.
Well, if you're extending the wrist a lot, and that's why it's called golfer's elbow. It could also be tennis elbow.
Tennis elbow.
Yeah, golfer's elbow, the other side.
Yep.
But because you're gripping so much with tennis elbow.
Yep. But you can get it without playing tennis. As a matter of fact, most people do, I think. At least most of my patients. And I had it on both arms, and I don't play any tennis.
Do a lot of using hand tools and trimming. That would all bring it on.
You bet. So the first thing, if you got that pain, I'm going to move this down so we can show it. You'll feel it right on that bone. And oftentimes, let's say you've had a hard day, you've worked it, you're irritated, it's very sore. The first thing you want to do is get a cold pack on it at a point where you can sit down and rest and relax. And that's what I have this on for. There's a couple ways to use a cold pack. You can use a gel cold pack like this. Don't put it directly on your skin. That's why I have a thin towel over it. And I got a Velcro strap actually used for ankle weights. But you can hold it with your hand, or if you can strap it on, it works better. Leave it on for 20 minutes and relax, and just let the hand and arm settle down.
That helps knock the pain down quite significantly.
If you want to get more direct, you can take a cup like this and fill it up almost to the top with water. Put it in your freezer overnight, let it freeze solid, and then you can see I tore. These don't have water in them, but you'll understand it. You tear the edges away. It's just a styrofoam that easily tears away when you have the solid ice in there. And then you put that directly on it. That's going to make your eyes open up a little bit. But after about a minute, it starts to get numb. And after 2 or 3 minutes, it gets, you're finding it really.
The advantage of that is that you can do it very rapidly.
Right.
I mean, you can cool it down within a couple of minutes, as opposed to the ice pack that takes 20 minutes.
Yeah. So it's a little messy. You got to put a towel underneath because it does drip.
Yeah. And once it gets numb, you can tell you can use 2 fingers, and if it feels like 1 finger, that means it's numb.
Sure. Good point. It'll be red, you'll see. And that's the advantage. It helps
hyperemia.
Help the circulation overall. So then also, if you want to use some ibuprofen, that's up to you, and make sure you know the amount to take. We're not going to get into that, but
yeah, I think a short bout of ibuprofen, I would try it.
Sure.
To see if you can knock it out.
That's not the list of 5, so don't count
Right.
that one.
That's not number
That
5, 2 or 3 or 4.
the next thing is, as I mentioned, those muscles will tighten up. Oftentimes, getting up out of bed in the morning, it can be real painful just to bend your elbow and to move your wrists. So we don't want to stretch it aggressively because it's tore already, micro tears, but we do want to get it moving in such a way that it does stretch the muscles fibers up in here. So just doing some gentle range of motion as it loosens up, you can flex the elbow and then you can pronate, move, pronate, and supinate back and forth. And you do these about 10
So
times.
you're flexing the elbow,
Yep,
then you go on hand,
yep,
palm up, palm down.
yep. And then arm out like this, a gentle fist, and go down, and then rotate towards your pinky
So
out.
if I'm doing both of them, I'm
Yep,
down, I rotate
yep.
out like this.
And if this creates some real sharp pain, don't do so much. It's a gentle stretch, remember.
So the idea is, if there were micro tears in there,
Hmm.
they're going to re-tear in the morning unless you stretch it
Gently,
gently. So that
right,
way you're preparing it for the day.
right.
You're starting to, rather than get a sudden jolt and tear open, you can
Exactly.
give it a little
It's like
stretch.
taking one step forward and two steps back.
Right.
The next thing is because we want to get the muscle bellies here relaxed so that takes pressure off. Plus, we increase our circulation. So the next one is simply massage the muscle belly, which is here, not up where it's connected. We're going to talk about treating that in just a second. And this is just typically you can do a cross friction massage on the muscle belly. But the big thing is just to get in and get those muscles to relax. And it helps with circulation as well.
It's a
Bob, do you have
good,
any tricks for
well,
that?
it's a good preventative one too. I mean,
Sure.
it's one if you start to feel a little bit of discomfort there or tend to be prone to this issue.
Yep.
I mean, it's just great idea to keep these muscles loose
Yep.
and get more blood flow to them.
Sure.
I mean, you're
Yep.
just going to have less problems. You're less likely to get it. I
Right.
mean, so
And then we're going to go to the cross friction massage, which is right at that point where the muscles connect. Now, you're going to have to use your judgment. If you go right on the real tender spot, you may have to back off a little bit. In other words, go this direction, and you're going to go this way across, and you're going to push down and get into those fibers and massage. And it may be painful at worst. Now, this is where you have to listen
it
carefully.
may be painful at first, but you'll wait another 30 seconds to a minute, and it should start to level out the
Or even
pain,
feel
or
better.
even feel better.
Yep. If, on the other hand, if you do it and it seems like it after 30
It's getting
seconds
worse
it's
and
getting
worse.
worse, it's not ready for that.
No,
Go back to your cold pack, do the massage on the muscle belly,
muscle belly. Yeah,
belly.
yeah, the belly. It's a new way.
That
of,
one too.
Yeah.
All right. Uh,
But this is a really good massage to do, the cross fiber. I've
right.
seen people
Oh,
where
yeah.
it's helped take it away. It's breaking up the scar tissue.
Yep.
It's
Yep.
helping it heal strong.
Right.
So it's a very good massage to do.
Yeah. Have good luck with patients. And we get a lot
Yeah,
of comments
a lot
back.
of comments, people
Mhm.
that thought or stated that it helped them.
Right.
So
Actually, we did this video a long time ago, and it's still getting
yeah,
good, strong
gotcha.
comments. Um, then you can use the elbow brace.
Sure.
This is an air cast. We like air casts. There are other ones on the market. And the idea is you're going to put that not directly over the sore spot, but close to it. And I like the air cast because they got a bladder, an air bladder that's squishy.
And it seems to be pretty comfortable.
Yep.
Yeah.
Now,
You've had this before,
oh
Brad.
yeah, I've
Yeah,
used this
No, I
exact.
mean you've had this disorder.
Oh
Basically.
yeah,
That's what I'm trying to
you're
say.
saying
but-
I have a disorder?
Yeah. yeah.
No, I no, Bob.
Yeah.
Why, Bob?
Did you have it on both arms?
I did.
Yeah.
I did actually. So you're going to put that over the muscle belly, close to the injury, and you simply tighten it down. Now you're not going to wear it tight the whole day. I always recommend to my patients keep it loose, but when you start doing something that irritates it, that's working those muscles, then tighten it down while you're doing that task. But if you leave it tight all day long, it's going to cause a
Yeah, you're gonna
circulation
have problems
problem.
there. But if
Um,
you look here now, what should be happening here, instead of pulling on the bone, if you think about a rope attaching to the bone,
mhm.
it's now pulling here. The force is being transferred to here, so you're taking the stress off
Right.
of that.
Kind of spreads that out a little
Right,
bit.
right.
So, and if you get this too close to your elbow, it gets in the crux of your elbow and it's a little uncomfortable, so you have to work with that. But I think that's going to be true with any.
With any
I
brace.
haven't
Yeah.
seen one that
That
it's just the mechanics of it.
right.
You can't get away from it. And these aren't real expensive, and they can be real helpful.
Yep.
So keep working all of those, and it's really going to make a big difference on getting this thing better faster, so you can get back to a normal life and not have that pain.
And remember, Brad and I are not just
Oh,
pretty.
we're pretty ugly.
No, we're pretty helpful.
Oh, that's right.
That's why you want to subscribe to us.
Right, right.
Thanks for watching.
I always forget that part.